Binge eating disorder is actually the most common eating disorder. In fact, it impacts more individuals than anorexia and bulimia combined, and yet it's the most undertreated eating disorder. So at the Eating Recovery Center, we utilize a unique and individualized treatment approach to treat binge eating disorder. At our program, our patients are in a separate milieu and in a therapeutic environment that's built for patients of all shapes and sizes. Our treatment is trauma-informed, values-based, and culturally sensitive. We treat the eating disorder as well as the comorbid psychiatric conditions and medical complications that might be being exacerbated by the eating disorder. So we have a multidisciplinary team working with our patients. Each patient has a psychiatrist, a medical physician, a nurse, a primary therapist who does individual and family therapy, a group therapist, a yoga therapist, and a registered dietitian. Our individual and group therapy is evidence-based to treat eating disorders and specifically binge eating disorder. We utilize cognitive behavioral therapy, dialectical behavior therapy, acceptance and commitment therapy, and exposure and response prevention. Our approach to family therapy is also unique. We utilize emotion-focused family therapy. In this type of therapy, we really focus on educating both the patient and their family on the eating disorder, where it came from, and how to fully recover. We do this by helping the patient and their support system align in recovery through communication, coping with difficult emotions, and changing behavioral patterns that the eating disorder has reinforced. Common treatment targets for our patients in the binge eating program are improving their ability to cope with difficult emotions and stress. And that's important because our difficult emotions and stress impact our eating patterns. And so we're working to regulate eating patterns as well as their responses to trigger foods, fear foods, or foods that are just generally avoided in fear of binging. So we're working to change that relationship with the food so that they can make less impulsive and emotional decisions related to food. Simultaneously, we're working on decreasing body image disturbance and reducing weight stigma. And then overall, we're helping them to regulate their sleep, improve self-care, and actively engage in their life in a way that really enhances their life, helps them live in line with their values, and fostering relationships that will be conducive to their long-term recovery. Hi, my name is Dr. Catherine Rossetti, and I'm the clinical director here in Houston with the Binge Eating Treatment and Recovery Program.